30 years ago, when I first joined healthcare, communications means were very limited. There were no handphone or internet. I remember there was an in-house hospital pager where the nurses would activate the doctor through the operator, and we would know the ward that we had to go to, but not the issues.
Everything was done manually, care was sporadic and was not integrated. Those of mainly acute medical ailments, and the range of medications we had was rather limited. Clinicians had to handwrite clinical notes, which was laborious, time-consuming, and sometimes illegible.
Everybody kind of knew each other in the ward. We functioned as a loose sort of team, but it was very cooperative, very pleasant. The interesting thing was the medical leaders of the time had a great vision for Singapore. We were aiming for a much better healthcare system than what we had at the time. It's brought medicine in Singapore to the level it is now. I think we should be very grateful for that.
In the last 10 years or so, there has been a significant change in the treatment with a shorter hospital stay, with faster recovery, lower morbidity and mortality. And we have some of the most advanced diagnostic modalities that provide a very detailed and precise information of the patient. And there has been a lot more structured training and selection to train our staff to pursue their area of interest in clinical, education, research or administration. These are all very significant improvements that we have achieved in the public healthcare systems.
I was glad to be part of the public sector because we were able to influence the course of management for the disease. We were able to be part of early trials, part of the various groups that looked into utilizing new drugs available, as well as advice on best practices. So for the future, we need to find the correct balance between encouraging and rewarding research and innovation versus containment of healthcare costs, as well as regulatory compliances, because a lot of disruptive technologies and biologies are being developed.
Doctors' role will remain very much the same, to heal some, to comfort always. There will always be newer technologies that will challenge the traditional ways of treatment. The challenge is whether our public healthcare institutions can keep up with these rapid changes, with the main goal of providing affordable and good medical care for the people of Singapore.
Future public healthcare will become increasingly innovative and automated with application of artificial intelligence tools. In pathology, automation is embraced in many aspects of the laboratory workflows. Digital pathology available at SGH is a catalyst for artificial intelligence in diagnosis, and I expect that moving forward, AI will become integrated into the routine diagnostic platforms. Complex laboratory investigations will be routinely conducted on blood samples with little need for invasive diagnostic procedures.
There are challenges in working in a public healthcare institution. We have demands we need to meet, but I take pride in the fact that the work we do reaches out to a large segment of society. We see the rich, we see the poor, we see construction workers, taxi drivers, hawkers. On the same day, we might see ministers, MPs, and we serve them all. And the beauty of it all is that it's a pleasure to work with our colleagues here. We have the wisdom of our seniors, we have the earnestness and the fresh perspective of our junior colleagues. We celebrate together, we learn from each other, and that's a never-ending process.
The timeless thing about public healthcare service is the idea that those of us who are in it are not doing so for the money, nor the comfortable life that it brings, but because we believe in duty and service. At the end of the day, the most enduring reward is the satisfaction that one that has lived well with caring, comforting, and even curing the patients over the course of your career. Not a bad way to live at all.